This is Jefferson Close-Up. I'm Carol Celine. My guest today is Dr. Alan Hilibrand. Welcome, Dr. Hilibrand.
Thank you.
Now, you told me you're a big-time runner. How'd you get into running?
Well, when I grew up in Cherry Hill, I was kind of a big kid and not really much of a runner at all, and I really hated it. And so when I got to college, I was at MIT, and right on the front door, out the front door was the Charles River, and so I found running to be a wonderful way to really organize myself both mentally and progress things physically. And it's been a great way, in a way that's helped me guide my life since then.
Do you still, do you do marathons and big races and things, or just run for pleasure?
I usually participate in the races here in Philadelphia, the half marathon, the Philadelphia distance run, the Rothman 8K.
Do your wife and children run with you?
Not usually. I try.
Tell us about your family. How many children?
So my wife and I have a 12-year-old daughter and a 10-year-old son. And we do a number of fun things with them, but I think that running is something for kids that's takes a little more than what they have in them, I think, sometimes, in terms of the mental exertion it takes.
So you're more into backyard sports?
Yes.
And now, you told me that you had always wanted to be a doctor, and yet you went to MIT to study engineering. That doesn't take the usual path to medicine.
Well, I was always interested in how things worked and sort of how the human body worked. MIT was a great place because they had so many Nobel laureates in biology and the sciences that I thought it would be a great place to get that education, and also to get a piece of the engineering part, which to me was sort of part of how things worked and making things work better, which is part of what excites me about orthopedics. Okay, so first you were an engineer, then you became a doctor, then you became an orthopedist, and then a specialist in spine surgery. Why spines? Spine is a very interesting area. We can do an extraordinary amount to help patients. Some patients can be made so much better, and yet there are some situations where actually patients aren't really helped with spine surgery. And so it's been very gratifying to me to be able to and a real challenge to choose the types of procedures that can help people, and then the types of people who can be helped by those procedures. And it's really, I think, a challenge every day. So
I think what you're saying is the importance of matching the patient's problem with the proper surgery.
Or matching the patient's problem with the patient and trying to understand the patient well enough to decide whether they actually could be helped with surgery. Because most patients who have spine problems really don't need an operation, and some who you'd like to help with an operation maybe just don't really have something you can help them with.
Well, it's great to hear that there are people you can really do something for. Thanks for joining us.
Thank you.